And here is an absolutely beautiful cross-section of an esophagus. Notice the non-keratinized stratified squamous mucosa. Notice a very, very nice muscularis mucosa just underneath the basement membrane of the epithelium. Notice the looser connective tissue and fat of the submucosa, and then notice the various smooth muscle layers. Remember that in the upper portion of the esophagus, you may see some remnant skeletal muscle fibers from the inferior pharyngeal constrictor, but throughout most of the mid and distal portions of the stomach, it's pure smooth muscle. And once again, here is the adventitia. Most of the esophagus is not intraperitoneal, so you could probably call this adventitia. Let's look at the whole thing in a little bit more detail. Once again, absolutely beautiful stratified squamous, looking a little bit columnar towards the base and a little flattened towards the surface. Here's the lumen. Notice it's not keratinized, and there are no hair follicles. Notice right underneath that, you have some smooth muscle. I think this could very appropriately be called muscularis mucosae. And the reason why you know it's muscularis mucosae because it's above the submucosa. And here is the denser connective tissue of the submucosa, some fat, mostly spindly fibroblasts and collagen. And then here are your various smooth muscle layers going longitudinal and circular. And sure enough, I think we have some skeletal muscle fibers mixed in here. So we were probably cutting this from the top part of the esophagus rather than the lower or inferior portion. That's beautiful. It's really the only place in the body, I think, where you can see a nice, beautiful intermixture and comparison between skeletal muscle fibers and smooth muscle fibers. And then once again, here we are out at the connective tissue of the adventitia, loose collagen bundles, relatively loose irregular connective tissue, chiefly fibroblasts. There's a little blood vessel there, maybe some fat, and we're totally finished with the esophagus. I thank you very much.